So let's talk about succinylcholine. It's the preferred paralytic for rapid sequence intubation. We're going to learn how it works, when it's indicated, when we should consider a different medication, and what we can expect to see after administration. So let's get started.
Sux is widely used because it acts fast and has a short duration. It works by binding to acetylcholine receptors and depolarizing muscle fiber membranes, thereby generating an action potential. Then it posts up there so no other action potentials can initiate. Your patient is paralyzed and ready for a tube. You might be asking,
but if it stops all action potentials, isn't the heart also a muscle that uses action potentials to contract? Will this stop my patient's heart?
Sux is neuromuscular receptor site specific, so your cardiac and smooth muscles won't be affected after you give it.
This is very important. Your patient must be adequately sedated before a paralytic is given. Because, can you imagine?
Nightmare, 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 nightmare.
So your etomidate, ketamine, or other protocol-specific drug goes in first.
Unless you happen to be a sleep paralysis demon. So when do we bust out the Sux?
Anytime you're gearing up for an intubation, a paralytic may be beneficial. Paralyzing your patient can reduce the risk of aspiration, facilitate mechanical ventilation, and simplify tube placement by relaxing the vocal cords.
There are, however, some times when we shouldn't use succinylcholine.
Most notably, because of its effect on skeletal muscles, Sux can cause serum potassium levels to increase. For patients that are likely to have high potassium levels, like ESRD patients, patients with rhabdo, and acute trauma or burns, succinylcholine should not be used. It's also contraindicated for patients with decreased plasma cholinesterase activity, muscle myopathies, patients with increased ICP, and history of malignant hyperthermia.
Dosing for succinylcholine is 1.5 milligrams per kilogram IV push.
It's most often in a 20 milligram per milliliter vial, so for a 100 kilo patient, we'll be drawing up and administering 7.5 ml of Sux. After administration, you can expect to see muscle fasciculations as the Sux binds to receptors at the motor end plate. It will begin to take effect within 60 seconds and has a duration of 6 minutes.